We'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth. We're here at Total Healthcare at the Mondawmin location with Dr. Arathusa Kirk. How are you?
I'm very well, thank you.
Good, and you're the Associate Medical Director.
Yes, I am.
Okay, well, tell us about pediatrics here and what sets Total Healthcare's pediatrics apart from other facilities in the Baltimore area.
Well, Total Healthcare has a total package of things that we can offer pediatric patients. Besides being able to see a pediatrician or a family practice physician, you can get dental services, you can get psychiatric and mental health services. We also have nutrition available. And patients can go to the lab at most of our sites. Within the center, we have pharmacy. So this sort of makes it easy for families to get everything that they need all at once.
Okay.
And we have a number of sites available as well. So there are many, many sites across the west side of Baltimore, and we constantly are expanding into other areas. We also have an electronic medical record. So if patients are seen for acute care at another site, the medical record travels with them in a secure fashion so that the other physicians can see what's going on.
Okay, good stuff. And pediatrics, for the record, what's the definition?
A pediatrician is specially trained to see, to deal with medical issues that pertain to the pediatric patient, which means birth to age 21. We try and transition people to adult care or an internist at age 19 here in our centers, primarily because most of them are dealing with adult medical issues at that point.
Okay. Do you notice a period where parents are less likely to bring their child to the pediatrician?
In general, people think of the pediatrician as the doctor for their infant to about 5-year-old, and generally think of them as helpful for the vaccine schedule. However, we do service all of the medical needs for children birth to 18. Particularly for the adolescents, a lot of them tend to not come back to the doctor, and we have facilities here available to do STD testing and pregnancy testing, as well as contraception management and lots of the preventive medicine mechanisms that are needed for that age group.
Okay, so generally speaking, if what should a parent have in mind when they think of the pediatrician? First, the shots, and I guess at some point, I mean, what's the chart in your mind, the timeline?
Birth to 18, but the primary message I want to get across is that the pediatrician is the doctor for the patient, for the child. And the nice thing about having a primary care doc is that that doctor knows the child and knows the family, and as opposed to going to an urgent care where you don't really know the patient at all, and everything needs to be reiterated over and over again.
So it's all about relationships.
Correct.
Okay. Good. Do you enjoy your job?
I do. I love my job.
Well, what do you love about it? Tell me one thing you love about it.
Kids are just wonderful. So every day I get a hug or a smile and a wonderful little fresh story from a child, and I just love it.
Okay, but I don't see the jar of lollipops. There are no lollipops here?
I don't give candy to kids, but I do give plenty of smiles and hugs.
Good deal. Thank you for your time, Dr. Arathusa Kirk.
You're welcome.
Associate Medical Director right here at Total Healthcare, Mondawmin Mall. Keep watching BeMoreNews.com, the news before the news, where we uncover the truth.